Welcome to the Health Fix podcast, where health junkies get their weekly fix of tips, tools, and techniques to have limitless energy, sharp minds, and fit physiques for life. Dr. Bhawna Malik, welcome to the Health Fix podcast.
Thank you so much for having me, Jannine. Pleasure to be here.
Well, we've had some fun already on Instagram going live, and so I have no doubt that in our conversations previously, we are going to have a good conversation today. So, of course, we're talking pelvic health. We're talking about heart coherence. A lot of people probably wouldn't put those two things together. What was the process of you figuring out, like, wow, these things go really well together? How did you learn about it? How did it come together? Give us a scoop.
Absolutely. So my work as pelvic floor physical therapist led me to a lot of diagnoses in different women of all ages, really. But working with them, it came to a point where there was this common thread, and more often than not, stress, how they were carrying that stress in their bodies, especially the pelvic floor, their ability to relax or not relax, rather. Was determining a lot of the issues that they were having with the pelvic floor, be it difficulty with, urination, pain during sex, or just tightness overall. And all of these symptoms are just like a little, tip of the iceberg, but there is so much more that goes on into that. And that's when the heart-brain coherence, ability to relax the muscles, on command, because we are supposed to, and if there is pain, too much pain happening during the menstrual cycle, during sex, none of that is normal. If there is leakage happening during, laughing, sneezing, that's not normal. It may be common. So these are all the common threads and pieces that brought us to, okay, these are really, really the three pillars, if you will, where the nervous system, the pelvic floor, and heart-brain coherence go together.
That makes sense. That makes sense. And, I think a lot of people at this point, it seems anyway, have seen heart coherence or learned about the nervous system. And probably the biggest thing that's kind of brought that to everyone's attention is the open conversation of trauma and trauma stuck in the body and things of that nature. Can you speak a little bit to trauma stuck in pelvic floor, hips? That area, perhaps you can twist it towards a little bit of the chakras for those folks that are under, well versed is probably a good word in those departments. Give us a little bit of background there in terms of how you've addressed that with different folks.
Yes, and I'm so glad you brought this up. And generally speaking, I wouldn't go in chakras just because I love to speak about science. But the truth is that in our we call it first energy center, where it's the sacral plexus, a lot of neurons are meeting up. So many neurons are meeting up to that one center where it's informing the brain about what is going on. And when I say what is going on, it means whether or not your body is either in the sympathetic or parasympathetic at a time. So then depending on what signals are coming from that sacral plexus or that pelvic floor region, the brain makes the decision of what types of hormones to now release and then circulate in the bloodstream. And there is so much research that's now coming out, like you said, with the trauma being stored in the body, that this is really very, very clear that there is a very close connection, and it's really so close that we can't separate the two. They are together, they go together. So unless there are steps taken to address that and then heal and release whatever it is that needs to be processed, the body can't function as it was meant to be.
That makes sense. That makes sense. Well, one of the other things along with trauma that I tend to see is the digestive system will tend to interfere with the pelvic floor. And a lot of folks who have constipation in my practice, I will often say, hey, have you seen a pelvic floor physical therapist? I mean, same goes with diarrhea and abdominal pain. I've even found that if folks work on their pelvic floor and they have diverticulitis, I've seen some change. So I'm guessing in the field of working with fertility, along with folks that have digestive issues, you've probably seen a little bit of connection between all of those things: fertility, gut health, pelvic floor. Give us a little background there.
Big connection, actually. So the constipation is, I would say, 90 to 99% of the time, that's how common it is when people are
Hmm.
having pelvic floor issues. And there's a very good reason, because right above the sacral plexus that I talked about is your gut, and all of the neurons are meeting now there to form the next plexus on that chain, and then informing again with the nervous system and taking the directions and communicating. Gut health, again, in the trauma is deep rooted in the body. And just like the pelvic floor, the body does not feel safe in those two energy centers when there is trauma present. And that is why when we change, the approach, when we address the root cause, when we start to work with the heart and brain coherence, we can undo years of trauma that was stored in the body using breath work, using heart and brain coherence techniques. There is also quick coherence techniques for folks who have busy schedules and the lifestyle and whatnot. So there are ways to address. And first thing is to become aware of what it feels like in the body. Because if people are so busy and going about with their lives, they sometimes don't even, they're so disconnected that they don't even know that if they're feeling that yucky feeling in the stomach, in the gut, in the, more lower, let's say pelvic floor region, what does it mean? And why are they having it? And then how to address it, actually, which is part two, which comes later once they have learned the tools and techniques. But prior to that, just being aware of what they're feeling is not normal. It shouldn't happen. And then they actually have some control over changing that. So, yeah, nervous system plays a humongous role in detecting the types of signals that these two centers are producing, and then communicating back to these systems.
I think a lot of people look at all of the different symptoms they might be experiencing, or they're looking at it and going, okay, how do I even start? What's one of the ways that you have folks starting to track their symptoms? Do you have like people writing out on a journal? What do you do, or how do you recommend exploring the symptoms and when they show up and helping to keep track?
Yeah. So a lot of times when I'm working with women, the first hour is really deep diving into where they're coming from, because two people with same age group, same diagnosis may look totally differently based on, of course, what else is going on in their environment and how they're processing the feedback from the environment and their body, and then how they are actually responding to the environment. So that's why that personalized approach becomes so, so important. And so there's a framework that I work with where I would look at the pelvic floor health and what's going on there, the gut health, the nervous system, the movement, and then sort of come up with, in all of these, framework, what is it that they need most help with, and then we go from there. And like I said, it will look totally differently based on what it is that's going on in their particular life and scenario.
Gotcha. Gotcha. Now, you mentioned movement, and we had talked about this before because obviously physical therapists specialize in pelvic floor physical therapy. So before you became a pelvic floor physical therapist, you did all the physical therapy things, and you had mentioned movement. I think for a lot of people, we're still not 100% sure of what mobility in the pelvis means. And, maybe they go to a chiropractor and the chiropractor tells them they have a twisty pelvis. Or maybe even their physical therapist has mentioned that. How does movement play into the pelvic floor? Where do you see restrictions, or where do you see, I'm curious. And also, like, even maybe hypermobility and like things like Ehlers-Danlos, or even in the case of a loosey goosey, I'm going to call it this because this is my terminology, guys, but loosey goosey, like pelvic floor connect, or not pelvic floor connection, but pubic symphinus. I can talk today. Boy, pubic symphysis connection, because maybe they just had a baby a couple months ago, the relaxin's still active, or the pubic symphysis never really seemed to come back together. It's a
Yeah,
long
that's a
question.
but it's a great one because that's true. A lot of times people are not sure what movement really means. In yoga, there is a saying that you are as young as your spine. You're only
Mm.
as old or as young as your spine. And I believe that is so, so true and right on. Because again, it's not the chronological age, it's the biological age that makes all the difference. Two 50-year-olds can look totally differently depending on how they're presenting. So the posture makes a difference. How they are, carrying themselves, the gait makes a difference. How much mobility there is in their spine makes a difference. And these are some major, major, key points. Most people, I would say, have low mobility. So hypomobility is more common. Hypermobility is present, like you said, after pregnancy, the ligaments, there is laxity going on, and then, yeah, there's a phase. And then sometimes in athletes where they have been used to, doing certain types of movements, or it could also be by birth, right? So there are a small percentage of people where there's hypermobility, where we really want to make sure that they have more stability at that point and their muscles are strong and doing what it's supposed to be. Because when their joints are so loose, they are prone to get injured. And so that's a different segment, but talking about the hypermobility. Now, looking at the lifestyles, people after a certain age in our Western culture lose so much motion just because the default lives that we live in. Most people are so used to sitting in the chair, couch, bed, they hardly ever sit on the floor. The pelvis doesn't get a chance to actually get that full external and internal rotation. And it presents issues. And it presents issues which ties into already if someone is having, let's say, difficulty or myofascial issues at the pelvic floor. Now the joint restrictions are going to add up, and then muscle restrictions, which, further pronounce the problem even more. So going back to that mobility piece, what type of mobility is also important, especially for pelvic floor, is something that is not much talked about. When I say that, what I mean is that, for example, the reciprocal movement has such a big piece for our brain, where when we are utilizing the opposite or these, twisting and turning in a guided, gentle way, but done properly, it also communicates with the brain in a way that it lets it know that the body is safe through movement. So we let the body know through breath work, like we talked about earlier, through heart and brain coherence. But even with that rhythmic movement, the brain gets informed that it is actually okay, things are safe, and so we can, start to relax. I hope that answered your question.
Absolutely. I think for a lot of people, yes, the hypo, so lack of mobility is definitely a big deal. I see it. And like you said, we're sitting on couches a lot, a lot of people can't even get up off the floor. And this is something that I used to when I saw a lot of folks in person, I would put them through. I'd be like, let's sit on the floor for a second, then let's get back up because it helps me to really see how mobility happens. Um and sadly, I'm seeing folks in their 40s really struggling with this. And I'm going, whoa, okay, hopefully you've got another 40 plus years to live. This is not a good thing. We want to make sure, we're getting moving here. But not only that, hypomobility and now pelvic floor. And we're wondering why, so many women are struggling with hormone stuff. So many women are struggling with gut stuff. It's, all wildly connected. So when you see folks online, are you going through movement analysis with them? Are you putting them through all the paces of sitting on the floor or doing whatever types of things you would think through?
Oh, yes. So the assessment does include looking and sort of assessing how they're presenting. But more importantly, going by what are they coming up with, what are they listing as these are the issues that, for example, someone is having, and then breaking it down to further. But yeah, movement analysis is definitely something that goes with that. And so seeing them through the lens and camera is definitely something that is part of the evaluation.
I find this really significant that you're doing that because let's face it, a lot of folks are specializing in fertility, and I don't see it happen where we look at mobility quite often. And one of like my most, I would say, profound cases of helping someone with fertility when I was seeing folks in person and doing a lot of acupuncture was seeing this one gal who had incredible hip like restriction on the left side and also had issues with her gut too, and realizing that all of the different supplements and things we were doing to try to regulate her period and get a good ovulation didn't really do the trick until we worked on that mobility. And so this is why, of course, I really wanted to have folks talk about this. Now, another thing that you kind of had mentioned, and let's switch towards fertility a little bit here. And I know that this probably doesn't apply to everybody listening, but I think we can all agree that this is great information to share with the younger generation. With fertility, do you find that a lot of women come to you on supplements, using progesterone, using hormones for fertility? I mean, aside from IVF, but looking just or IUIs, just looking at general starting. Are people using wild yam creams? Do they come to see you with a bunch of different supplements on board and nothing's working?
Most of them do because they're already trying. They've been trying to conceive and they have. So the first thing what they think of is going on Google and looking up the
Mm-hmm.
symptoms, and then they come up with the supplements. Supplements, yes, for sure. Now, as I'm sure you know, uh, the way that the supplements are in our country, there is no standardized way. So a lot of times it's just about you can close your eyes and pick anything really. It wouldn't make much of a difference unless you really, really know where it has been sourced, has it been tested, what's going on, and those details. But most people don't. So yeah, they do have some sort of supplements as a baseline when they
Yeah.
reach out. Yeah.
Are you recommending anything? Do you find that you either have and keep in mind we all know that like everyone's individual. I don't want to like give anyone the idea that we're saying you have to do this. It's more like, do you find that there's something that tends to be beneficial for most women who are struggling with pelvic floor and heart coherence? Is there anything like adaptogenic herbs, magnesium? I'm just throwing out things, CBD. Is there
Mhm.
anything that seems to be a probably a good thing to have on board? Maybe fish oil. I don't know. I'm just throwing things out.
Well, my number one thing is almost to look at their nutrition super, super closely and make sure that they're at least doing the bare minimum because nothing beats just pure vegetables, fruits, water, and, of course, the fiber and, all of those things and protein that goes into it. So just making sure that they have a full rainbow going on their plates, which is super important. And a lot of times that's something that they don't even have yet. And yes, they're taking supplements, but we really need to address that. So yes, with the busy lives, whatever we can do is good, but just understand that it's affecting your hormones and fertility in a bigger way than perhaps most people understand. So that's of course number one. But no, the research definitely points fingers towards some of the main supplements that make a big difference, including CoQ10, magnesium. There is also a prenatal, so folate acids. Those tend to be really a good starting point. And like I said, main area of focus should always be what they're eating in their on what's on their plate is the biggest thing.
Absolutely. Absolutely. I mean, I think we can get, and I've been there with folks and trying to support fertility in whichever way we can. And yes, the different supplements, and it can be overwhelming. And I think, we can't supplement our way out of a poor diet. That we just can't do. So important to think of it that way. Now, in terms of looking at different phases of the cycle. And I don't know how you believe about this. I believe that even when we don't have our periods anymore, meaning either it's stopped, we've gone into menopause, that we still have somewhat of a rhythm and cycle. And so I'd love to get your opinion on that. And I'd also love to get your opinion on, folks who are still cycling. What types of things might you recommend between follicular and luteal phase, or even the phase of the period and the phase of the ovulation? Are there certain little tidbits that you can share with us that may help someone who's thinking, yeah, I probably do need to work on my heart and my pelvic floor a little bit?
Absolutely. And this is such a, good topic to bring on because I feel like with the social conditioning and the way we are raised, most women don't see the connection, though there's such a big connection between all of those things. And to start off with what you said, yes, even after the cycle has stopped, there is still rhythm to the body. So that absolutely goes on for the female system. That's just the truth of it. Now, food and activity both matter, and especially let's start with the menstrual cycle, that phase. Our bodies are naturally guiding us to take it easy at around those times. So when it comes to the exercises and movement, what we should be doing at that time is really taking it easy, just gentle movement, gentle walking. And that's what the body is really asking for, and that is the most conducive environment for the hormones, be it, if the fertility is the goal, then yes. If not, just overall for, wellness and health, that is what, when we do the right things, body will follow and have the right environment and things for us. So that's the phase when there's menstrual cycle. And then let's talk about ovulation. That's when we feel like, oh my God, I can take on the world. I can do everything. So that's the time to go do your, strength workout, the cardio that you've been waiting, all of those things perfect for that time. Food wise also, if someone is really in touch with their body, they'll know that right before the period, they start to feel this heaviness or bloating. It's their body letting them know that not every food is right now for me. So really watching the food. And this is something that's big in Ayurveda, where they really focus on warm meal versus cold food that's been sitting or fridge, like salad, is just harder for the body to digest. And the bloating is the direct sign where the body will let you know that, okay, if it was a warm, nice, meal, it digests in a different way. Bloating is minimal versus having something that's just, cold food, or salads are great, but around that time it's affecting the body differently. So there's so much more that goes on like on the deeper level, where how even the moon cycles are affecting the menstrual cycle, and is so closely connected. Something that has been established in yogic culture so many thousands of years ago, and I'm sure that research is still sort of there and coming, but these things are so connected, and we are not so apart from the nature. It's like it's like we are part of it. And
Yeah.
these things are proofs. So yeah, what we eat, how we even rest, how we move, all of those things are done in a certain way. That's why the 8 to 5 culture, all of the jobs and everything, I always see that as this was designed for a male society primarily, because the female body, female system works quite differently. And so there are days when we can do 8 to 5 and more, and we in fact do 24/7 for those of us who have so many things to take care of. We know what that's like. uh, and yeah, so that's definitely something to consider when it comes to choosing the right types of workouts and the food options, depending on which cycle you are in. In my coaching practice, we do what's called cycle syncing, which is exactly this, where we really get super clear. And then this is very informed and empowering thing, because once they start to follow this protocol, so to speak, their bodies will let them know whether it's working or not. So all of the symptoms that they were having, for example, pain during menstrual cycle, bloating, heaviness, fatigue. So when we start to do the cycle syncing, it takes care of those symptoms.
Wow. I think for a lot of people, they're like, no way. But it's true. I mean, I've seen it too with cycle syncing. Now, for those folks who are not having their periods and they've gone into menopause, what kind of cycle syncing will you do for them? Are you looking moon cycles? Are you looking at their individual rhythm and kind of asking, getting more details from their body as to what their rhythm is?
Definitely their individual symptoms and what do they experience, because believe it or not, every month they'll have the same occurrence of what's going on mentally, what's going on physically, and then it repeats, it keeps on repeating. So really that personalized approach part is all about getting clear about what is going on, how's their sleep, when did so, and once we start to track that data, it gives us a very clear picture about where to move next from that point on.
Yeah, I think it's important to for folks to really think about that. Now, the other big thing, with the part of the heart coherence is, of course, heart rate variability and heart rate in general. And I think a lot of folks have seen on their different apps that their heart rate variability over time has gone down, or they get excited when their recovery, it looks like they recovered the night before, and it's measuring things like heart rate variability or sleep scores or things of that nature. So, with specifically looking at heart rate variability and different type parts of the cycle, can you speak a little bit to the different cycles time frames, I guess, and where heart rate variability might actually be lower normally because your body needs more time to recover, and it's a sign to look at syncing?
So the heart rate variability is now undoubtedly the most important marker compared to what used to be just looking at the heart rate, because it really doesn't give full information. Heart rate variability, on the other hand, shows us that what goes on into our heart rate when we are, met with situations that may be super challenging. So the heart rate variability goes really up. And then what goes when it's really down? So it's the graph between that high and low that shows us that how well equipped our heart is to meet the demands of the environment and going from really low to really high. And that is what really shows the overall cardiac health. Um, so the goal for a lot of the heart and brain coherence techniques that we employ is to improve the heart rate variability, and to not only have the heart and brain syncing in together, but also to actually have that reflected on the heart rate variability. And now your question is about which cycle it should be more or less. Well, ideally there should be more heart rate variability all across, and that's what we are shooting for. That's what our goal is, to really be working on it, so that the heart rate variability where it was, what we're looking at is like the past measurement, and now going on forward with using those heart rate techniques, how much has it improved for us. So that's like regardless of the cycle, we are looking at that growth from the point that we started to where we are at now.
That makes sense. I think for a lot of people, they're looking at their heart rate variability day to day versus over the course of a full month. And sometimes I think, and of course, give me your opinion here too, because I feel like heart rate variability is a trajectory. We're wanting to see it go up over time. But when we have devices that tell us day to day where we're at, and it can get us into a cycle of, oh, what I'm doing isn't working. How do you answer that in terms of the cycles? So, say someone's in luteal phase and they're pushing themselves a little bit harder in workouts and not seeing the recoveries. That's kind of more of a context. Sorry, I didn't give you as much context before. So, how about that? What would you say in that department with HRV?
Um, yeah, so each data is information. And so if they're noticing shifts in their heart rate variability, I encourage them to actually look at what they were doing prior, because whatever activity or, conversation they got engaged in, something happened at work, they were, engaged in something Usually the things that get recorded are sort of emotional or stressful. So whether it was either they were super happy, they were at a football, match or something, and then they got really excited, or they were at work and they were in a meeting and they were really stressed. So then it showed up on the graph. So each piece of information is showing what were you doing just prior to that data, and then tying it in together. Because if it is showing that during the luteal phase, you were really not giving your body a chance to rest and you were pushing yourself, look how that affected your heart rate variability. And now moving forward, can we make some changes to address that and then improve this? Because that data is providing us information. And so how we use it is now on us. And so I wouldn't encourage constantly looking at the heart rate variability on the devices. And I know that in itself can present just anxiety looking at all the time. But it is a piece of information to look, let's say, checking it maybe once or twice a day. It's okay. And then taking that information and then tying it into, okay, what can we do better now?
Yeah.
Yeah.
Now, in terms of technology to monitor our heart rate variability, what's your preferred tech? Do you have a favorite brand or technique or company? I guess it's probably brand or company.
Yeah, so actually there's a device. However, with most of my clients and patients that I work with, unless they really want to buy it, I don't really tell them to buy it, because honestly speaking, the whole purpose to get that, technology and understanding is a feedback mechanism, right? So as long as they understand, the whole idea is for them to shift their own emotional regulation, shift their own internal environment to a point where they realize, first of all, that where they were wasn't serving their body. And now, okay, once they have the awareness, what can they do to shift the internal environment that's actually more conducive for them? So the HeartMath Institute actually has a free app, Global Coherence, where you can just actually, if you have iPhone, you can touch on the camera with your index finger, and it actually measures your heart rate variability for you. So if you don't want to invest in technology, it's totally okay, and that serves the purpose just as well.
Hmm. Interesting. Interesting. Yeah, I've had an Aura ring, I've had the Whoop, I've had, and then there's Apple Watch and everything too. And I've had even specific HRV measurements that are monitoring at overnight, versus all day long and taking snapshots. So I don't know how you
Mm-hmm.
feel about the different types of technology. If someone's going to invest, do you want them, or I hate to say the word, do you want them? What is your preferred one if they were going to invest? Which one do you like the best? Is it the heart math? The best?
Yes, HeartMath is what I would go with. I believe it's called Inner Balance or Balance device. The name of the device is that I think it's Inner Balance, but that's a pretty good device where it's really showing on the app itself and on the device, and pretty good way to measure and keep track and really get good with it, because once we've practiced it so many times, it becomes a skill.
Yeah. So of course now folks are like, okay, we need to monitor our HRV. We're watching our cycles. How do we work in the moment with our heart rate variability in our heart and really work to achieve heart coherence? What's one of your favorite techniques maybe that folks could leave this podcast with and try it out and see how that goes?
So that comes with a lot of practice, but the one that I like the most is simple techniques. So within their environment, uh, just slowing down and then inhaling through your nose 4 seconds, holding 4 seconds, and then exhaling through their mouths 8 seconds. Only if it's done even for a minute to 2 minutes, it has the ability to start to shift your brain waves, and your brain waves determine which state of mind you're going to be, and then like I said, the heart and brain work together. So once the, brain waves are lowering or slowing down, so does your heart rate and the variability that starts to respond, in the correspondence to what's going on with the brain waves. And if you couple that with, let's say that people are not used to it, and so reaching for gratitude or joy in the moment when they're really having a big stressful moment seems like is too out of reach, the brain waves or the information, even if they say that, yeah, I'm going to feel grateful, uh, the thing is that if so the body is very smart, and if they reach for that when they actually can't reach for it, it would be like your body is going like, no, you're not. You're not grateful right now. So be authentic. And if it's if the closest emotion at that point is, let's say, relief, go with that instead of going all the way and feeling, grateful when your body can't go from there to there.
I think you
So
bring up a really great point. Because I think a lot of people say that to themselves, like, I'm grateful, I am happy, I am this, but really they're saying it, but their nervous system doesn't match the sentiment.
exactly. And that's what happens when people are making those affirmations. Yeah, it's like, okay, you can do it, but you can't fool your body. Your body knows, your body going like, no, you're not, absolutely not. And the information is actually not going past your brainstem at that point, because the brain
Mm.
wave states are so high, they are in high beta when they're stressful. Brain wave states need to be reduced down to alpha and theta and then delta. That's how we know the process goes when we go to bed, and then when we wake up, they slowly move from delta to theta to alpha to beta. Um, and so when someone is really in a stressful or situation where they're so like perked up and they're really ready to do something, and reaching for gratitude is not very likely. So best thing is to just be honest with yourself and your body. Your body will know anyway. And so just work with the breathing, number one, and then reach for something like, I'm okay, or relief, I'm safe, just that much.
That's hugely important because I think it really is. And I found this with myself too, is like sometimes I will try to get into a state of calm. And, when I know that something set me off and I'm trying to be like, I'm not mad. I'm not mad. I'm totally not mad because I'm mad. I'm totally angry, and so you'll get into that point and you're like, I'm trying to breathe. I'm trying to calm this down, but I need to let the emotion go and work through it.
Yeah.
So it sounds, like, yes, work through it. Don't lie to yourself.
Yeah.
Don't try to force it.
I mean, that's really just the conscious brain. We can do that. The subconscious knows the full story. So your body is going like, no, you're not grateful. You're nowhere close. So
Oh, funny. I mean, it's, and I think that's why a lot of people too will tell me like, my life's not stressful, everything's good. I don't know where to begin. I find that sometimes it goes back to the emotions and what we're telling ourselves and things of that nature. How do you approach that? I'm fine, everything's okay, everything's great, but there's
uh
infertility and there's, or there's some serious hormonal dysfunction in terms of periods.
yeah, and the funny thing is that a lot of times when people start off by saying that no, there's nothing and absolutely, it turns out a lot of times that they not consciously, but on subconscious level, there is so much that they're upset with their body, that their bodies sort of they're thinking. Now that's not the truth, but that's how they're thinking, that their body's disappointed them, and so they're actually pretty upset.
Yeah.
And to even admit that something is wrong, it's like they see that as a failure, but it's, as we know, that is far from truth, right? So um but in the beginning, yes, it takes some really sitting down and getting to what it is that this issue has caused in your physical, mental space, that has affected you the most. And when we get down to really talking about those things, people start to really put it, because they haven't even admitted this to themselves. So when they're saying that I'm not stressed, they're in a way being honest, because they haven't admitted it even
Mm,
to themselves yet. It's only when we
right.
start to dig deeper and we put those, connect those dots, they see that actually, yeah, my whole life is revolving around this matter, whether I say I'm stressed or not. Every vacation, every plan that I do is now based on what if I get pregnant, or what if my plans change. So I'm saying that I'm not stressed, but in truth, everything, every decision that I'm taking is around that topic which hasn't happened yet. And also, if I get invited to someone else's baby shower, how do what that does to me. And so yeah, it takes some digging deeper, and really, again, being honest, with oneself, and then truth comes out.
Yeah.
Yeah.
Oh gosh, having worked in the fertility industry when I first started to practice, it is it's a tough industry to work in, especially when, a lot of folks are struggling with, friends getting pregnant, baby showers, all those different things. It's incredible. And I think this even translates into like perimenopause, menopause too, when folks are having lots of wild symptoms, from like periods that won't quit to fibroids, deciding they're going to release a little bit more blood, and you're not ready for those kind of things too. So, where I'm going with this is that it does seem that we have a lot of different things that we can be focused on and obsessed over, like getting pregnant. Or I'll do another great one that's in the perimenopause, menopause space, is that belly fat and gaining weight. Can you speak a little bit to focusing on the problem versus working on the solution and working on different things to help, and what that does to your HRV over time when you're so obsessed on the outcome and not working on what you can do to actually get to that place without focusing on the outcome? That was the weirdest question ever. I'm hoping you know.
I know exactly what you're saying, and it is right on point, because believe it or not, um, regardless of the age, whatever the main thing that people like we get focused on, right, becomes their whole entire focus. Now, what that does to the body in a very physiological way is that that focus and attention is now robbing their body's resources, which could be used towards rest and repair and restorative function, is now the entire time fighting with that perceived threat, that what if this doesn't happen, then what will this happen, and then the worst case scenario, and that is the sympathetic system, that is the cortisol spike, because it's all the time occupied with this XYZ problem that I'm having, right? So that mindset shifts everything, not just to say that, yeah, think positive. It's not just purely or just dismissively saying think positive. It's physiologically is affecting the body, because, like I said, the body's for body is, perceived or real threat is considered as real threat. And so the the sympathetic hormones and that increased spike that we get from the cortisol and that adrenaline rush is getting all the body prepped up for, okay, there's a threat in danger in the environment, so we got to be ready for that. And that's not the time for body to feel safe. And we go back to the same loop that we talked about in the beginning, that doing that is actually making it harder. So for in the instance of fertility, conceive, because the body has to feel safe before it can be a home for a baby. That's a big deal. The body has to really feel safe. And in other incidents or other, diagnosis, same thing really happens, where, if your body does not get a chance, and always, being super hyper focused on that problem, but not the solution, it shifts how your body reacts to it on a very physiological level. Your immune system responds to this type of thinking, because your immune system, like I said, is preparing for that, getting that army ready for that possible fight or flight or whatever is going on, is the danger. So as literal as it sounds, but that is the truth. And that's why this heart and brain coherence reverses that whole story, because we can change our stories. And once we change our stories, we can also start to shift the perspective and then understand that my job is really, really, really to focus on the solution so that the solution appears. Because when I'm so focused on this problem, it's only worsening my body chemistry, minute to minute, day to day level.
I couldn't agree with you more. And I think it's one of the things that all of us in the medical space struggle with, because we have ICD-10 codes and we have, diagnoses. And when someone gets a diagnosis, it can be incredibly, rewarding for them because now they know what's going on. But at the same time, what trends to happen, and especially in females, and whether it's fertility, whether it's Hashimoto's thyroid stuff, whether it's perimenopause, menopause, heavy periods, whatever, we join the forum, or I'm saying old school forum. We join the Facebook group, we join the groups, we follow all the people, and now it's like inundation of all of the information, when in reality, looking towards solution, focusing on working on the solution, not on this problem, is probably one of the biggest secrets to unlock anything when you're looking at healthcare.
Absolutely. Absolutely. And especially when the common theme of a lot of these support groups is, look how bad my situation is. And then, there's a general theme that no, mine tops and mine is the worst. No, 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 I got my worst one. So, yeah, that's not helping anybody if that is, of course, how it is. Now, there are a lot of times when they're supportive and they're more solution oriented, and if that is the case, they're amazing, because that community gives us that connection, and it really feeds in that emotional regulation piece, and gives us that empowerment sense, because we can do so much than the society has conditioned us to believe, and so much is still in our hands that we can do. And so if it is used, like I said, in the right environment, it's a great thing, empowering to have that kind of support system. But if it is a support group where it's constantly going like, who's the bigger victim, then it's not a conducive place for anybody.
Absolutely. Something to definitely check out, and definitely one of the spaces that, I try to avoid folks to head towards. So of course, speaking of community, you've got a lot going on with Yes to Pregnancy, and I definitely want you to share a little bit about how you're helping folks. Tell us about your website. Give us more of the scoop, because I think by now folks might be like, might she be able to help me with certain conditions? Maybe even just regular pelvic floor, stuff that doesn't have to do with fertility, but perimenopause, menopause. Give us the scoop there.
Absolutely. So, like I said, I my main focus is infertility, but I also work with women, of all ages, hormonal issues, gut issues, and we work really getting to that root cause. That, on an average, it's shown that a doctor spends 6 to 7 minutes with the patient, and that's, we know, is not enough time to get to the root causes. And a lot of times their questions or issues get ignored, and and so that is what I really love doing, spending that one-on-one time and really getting to be that person who's bridging the gap between the current medical system and their real health. And so, whether it is helping them with reviewing their labs for them, or coming up with that plan based on where they're at. We're looking at their history and checking out what's going on with the pelvic floor, gut health, nervous system, their movement, and tying it all together. And so from there, we work together. And yeah, you can find me on Instagram, Yes to Pregnancy. Same thing with the website. Like I said, the best way to find would be Instagram, and I would love to connect.
Well, thank you so much, Bhavna, for coming on, because I think it's really important for folks to hear how so many things are connected pelvic floor wise, but also the connection with the HRV, because, I think a lot of people haven't really learned that we have a way to monitor our nervous system, and that HRV is a very big call out to where you may be hanging out in any given case. And so I'm really glad that you're using it and educating folks on it. So we'll definitely have to come back, talk some more as time goes on, and see what we can do about keeping the education going about HRV.
Absolutely. It's been a pleasure. And Jannine, thank you so much for having me here. I really appreciated our talks.
Hey, my pleasure. You guys stay tuned. I'm going to put all of the notes and everything with yes to pregnancy in my podcast notes at drjkrauseND.com. Thanks again for coming on, Bhavna.
Absolutely. Thank you for having me.
Hey, fellow health junkie. Thanks for listening to the Health Fix podcast. If you enjoyed tuning in, please help support me to get the word out about the podcast. Subscribe, rate, and review, and just get that word out. Thanks again for listening.